Family Support Services is comprised of highly educated and skilled child life specialists, music therapists, social workers, and other professional team members who help enrich the hospital experience through play and technology. Our team is committed to partnering with multidisciplinary teams to elevate the care and support for our patients and families. Now let's meet 3 of our Family Support Services team members and allow them to share about their roles here at Wolfson Children's Hospital. First, meet Morgan Maxwell, one of our 3 full-time board-certified music therapists. Morgan, how does music therapy collaborate with the multidisciplinary team?
So we work in the hospital with doctors, physicians, nursing, all of the different disciplines to really create that psychosocial support all around. We ask how the kids are coping, how they're doing, and we inform them of how the kids are managing in the hospital. We even report after about their developmental milestones and the thing they're reaching through music so that we're able to help the team stay informed. As a music therapist in the hospital, I'd like for people to know that we are trained in music therapy. We know how music best impacts the body and the brain, and we intentionally use it around the hospital to impact development, coping, self-expression, physical goals, all of the many things that our kids need here to manage their developmental milestones, to help them cope appropriately and express themselves.
And a little personal, what is your most memorable intervention or patient encounter that you've had here at Wolfson Children's Hospital?
It has to be around me working with songwriting with a patient. The one I can think of right now relates to collaboration. I worked with a child life specialist and a nursing team to do a nasogastric tube, an NG tube with the kiddo. Typically those are very uncomfortable and really hard for kids to cope through. And the little boy and I wrote a song together. We said we were gonna breathe, we were gonna hold still, and during the procedure he sang it with me and he coped impeccably. So that happened recently. It was very impactful for me.
That's amazing.
Yeah.
Fantastic. Thank you very much.
Yeah.
Next, meet Tessa Cook, one of our 12 certified child life specialists. Tessa, tell us about the important role child life plays in the hospital setting.
Susan, one of the most important roles that I think a child life specialist plays in the hospital setting is identifying the stressors that patients and families have when they come into the hospital, and then finding ways to reduce that through preparation, procedure support, distraction, end-of-life bereavement, and diagnosis education.
Excellent. How do child life specialists collaborate with the multidisciplinary team?
One example that I can think of is I utilize the nurses on my unit very often to get that patient information that helps me prioritize my day. And we collaborate with other team members like physical therapists and OT to align with the plan of care goals. Our child life team is present throughout multiple spaces throughout the pediatric hospital. We are not present with adults. We say that adults should have child life too, but we service all the units throughout the pediatric hospital.
What is your most memorable intervention and patient encounter that you've had here at Wolfson Children's Hospital?
I love that question. It's hard to choose. One I can think of is that I had a 9-year-old patient who was on the autism spectrum who had to come in for an NG placement, and mom had shared with me that patient had had many struggles with previous times in the hospital setting. I utilized preparation and procedure support, as I mentioned earlier, and he was able to cope very well throughout the NG placement. No tears, no distress, and mom had shared her appreciation for the services and her surprise at how well he had coped.
What a fantastic way to show and share with others the way that we support patients and families. Thank you.
Thank you so much, Susan.
Last, please meet Deanna Holmes-Shell, one of 18 social workers here at Wolfson Children's Hospital. Deanna, can you share how social work collaborates with the multidisciplinary team?
Yes, we advocate for patient care, we assess for potential barriers, and make community referrals when necessary. We're family oriented. We're here to support our families and bridge the gap between the hospital and community.
Some personal note, what is your most memorable intervention or patient encounter?
My most memorable is seeing complex congenital heart patients discharged from the hospital and follow up in the clinic and to see them thriving and happy.
Thank you, Deanna, and thank you to Tessa and Morgan as well for sharing about the work that you do here at Wolfson Children's Hospital. We hope that you learned something new about family support services.